This is Charles Motti, and this is Emily Caggiano. We are going to be recording the health assessment assignment for NU 650 for head, eyes, ears, nose, throat, and neck. Emily, do you consent to being filmed for this assignment?
Yeah, I do.
Okay, thank you. I'm coming in, I'm washing my hands. I'm starting by inspecting the scalp. I'm inspecting for any lesions, deformities, any masses. Also, as I lightly palpate, I'm looking to see any reaction to tenderness. And there are no masses, there are no lumps, there are no deformities. I'm going to now turn and inspect the face. I'm noting symmetry. I note that the face is symmetrical. I'm also looking for any swelling, any edema, free of swelling and edema. Facial expression is appropriate to situation and no involuntary facial movements. I'm now moving down and I'm inspecting the eyes, moving on to the eyes. And I'm noting that there is no scaling under the eyebrows, that there is an even distribution of hair in the eyebrows and the eyelashes. I'm noting that there's no crusting under the eyelashes. There is a little excessive watery discharge from the left eye. I'm now going to inspect the sclera and the conjunctiva. You can look up. And I'm looking for any foreign bodies. We can look down, any lesions, vasculature. I am noting in the left eye that there is increased redness, increased vasculature, especially around the iris. And the right eye, I'm noting that the conjunctiva is white. And I'm now looking at the pupils. I'm noting that they are round, that they are equal, and they are approximately 4 millimeters. Okay. And now I'm going to ask if you could cover one of your eyes and holding this at arm's length, if you can read, starting at the bottom, the first line that you can see in its entirety.
LTFPH.
Excellent. So that is the lowest line. It is a 20/20 line. You can do the same, but with the other eye.
LTFPH.
Excellent. So we have 20/20 vision in both eyes. I am now going to ask you to look at a point over my left shoulder. Stay fixed on that point. Pupils are constricting both to direct light and accommodation. And same in the right eyes. Both eyes constrict, pupils constrict to direct light and to accommodation. Now staying with that point, if you can, then as I place an object front, please look at that. And pupils are constricting to accommodation. Now going to test visual fields to confrontation. I'm going to move my hands forward, wiggling my finger. If you can let me know, keeping your eyes ahead and your head looking straight forward, tell me when you see the finger wiggle.
Yeah. Yep.
And moving in a circular motion.
Yep.
Around the visual field.
Yep. Yep.
So, and now I'm going to ask you to look at my finger and just follow it. We're looking at all the cardinal points here. So visual fields intact, confrontation, extraocular eye movement intact. I'm now going to look at the fundus of your eye. It's going to be a light, bright light that I'm going to be shining into your eye. Okay. Okay, the red reflex is present and the optic disc is visible, as is the fovea. Optic disc is well defined. Red reflex is present, optic disc is visible, well defined. Okay. Now, going to be assessing the ears. I'm starting by looking at the outside of the ear, the cartilage, the tragus. I'm looking for any lumps, masses, any lesions, malformations, deformities. No lumps, no deformities noted. On the right ear, I am now inspecting the left ear for the same, and also no lesions, masses, or deformities in the left ear. I'm now looking inside the ear canal. I'm looking for any foreign bodies, any discharge, cerumen, any redness, swelling, and the left ear is free of foreign bodies, discharge, swelling, as is the right ear. Okay. And now I'm going to look into the ear. Pulling back and up to open up the ear canal. And the tympanic membrane is visible. It's pearly gray, free of perforation, free of foreign bodies, light reflex, no discharge, no cerumen. Back and up. Tympanic membrane is visible, pearly gray, reflects light, free of perforation, free of discharge, redness, lesions, masses, foreign bodies. Okay. And move this out of the way. Okay, now I'm going to ask you to please block your left ear. I'm going to whisper a word. Please repeat it. Baseball.
Baseball.
Okay. If you can cover the right ear. I'm going to repeat a word. Apple.
Apple.
Okay. Thank you. Now we're going to do the Weber test. I'm going to place this on your forehead. Please tell me if you hear the sound lateralize in one ear or the other.
I hear it in both ears. Same.
Okay. I'm going to place this behind your ear. Please tell me when you no longer hear it, at which point I'm going to place it beside your ear, and tell me if you still hear it at that point.
No longer hear it.
Okay. Same on this side.
No longer hear it.
Okay, very good. Okay, so I'm going to move now on to the nose. I'm inspecting the nose for symmetry, for any lesions, masses, deformities. None are noted. I'm going to palpate for foreign bodies. None are noted. Also going to palpate here and here? Any pain?
No.
Any pressure?
No.
Okay. So putting a new, I'm now going to inspect the nerves. You tell your head, please. Free of foreign bodies, nasal polyps, no discharge, no lesions, no masses, pink, moist in both nerves. Septum is midline, no perforation. Okay. And if you could just close your eyes and tell me if you smell something, what the smell is.
Coffee.
Okay. Thank you. Correct. Okay. I am now going to inspect the mouth, starting with the lips. They are pink, moist, no ulcers, no cracking, no flaking. If you can open up your mouth, looking at the mucosa, is pink, moist. No lesions, no masses. Lift your tongue for me, please. Pink, moist. Some cavities, teeth, all teeth appear to be present. Any loose teeth?
No.
No loose teeth. Okay. Say Trachea is free of foreign bodies. No lesions, masses. The uvula and tonsils rise midline. I'm now going to move on to the neck. I'm starting by assessing the neck for symmetry, foreign body, or lesions, masses. The neck is free of lesions, masses, deformities. I'm going to palpate the lymph nodes. I'm starting here with the preauricular, posterior auricular, occipital, the tonsillar, submandibular, submental, superficial cervical, posterior cervical, cervical chain, supraclavicular. Lymph nodes are non-palpable, no tenderness noted. I'm now going to palpate the trachea, noting that it is midline, no swelling, no edema, no deformities. I'm now going to palpate the thyroid gland. Ask Emily to please swallow. No nodules noted, no pain on swallowing, no deformities for the thyroid gland. Okay. And that concludes the assessment for NU 650, head, ears, eyes, nose, throat, and neck. Thank you.